In our day-to-day lives, people have mood swings, some high and some low. When these mood swings become extreme, one is diagnosed to have the bipolar disorder. I'm Angelina Nalo, and today we are going to have an insight on the bipolar disorder. The bipolar disease is a state whereby, yes, there are mood swings, but in the bipolar disorder, these mood swings have to be in a long period of time. The highs of the mood swings in the bipolar disorder, when you're high, your mood is elevated, you want to do a lot of things, you're so happy, and they're in extreme, and it lasts for at least a week, not a day or two. It lasts for at least a week. It's in an extreme mannerism, and it should be followed by a depressive episode, which is a low mood, being sad, when you're low energy levels, and also the depressive spectrum has to last for at least also a week. Hence, you're diagnosed with bipolar disorder. Not 2 to 3 days. Bipolar disorder, we usually diagnose it when the mood swings are extreme and they last for a long time. The manic episode lasts for a long time, or the depressive episode lasts for a long time. Hence, that is the only time we will describe or we will diagnose you with a bipolar disorder. In our today generation, a lot of people use that word bipolar in a mistake, as in the wrong way. You just, yes, you are low and stuff like that, then you're telling your friends, I have bipolar, to explain your mannerism and what not. But that's not what actually bipolar is. Bipolar has to be an extreme episode of mania followed by an extreme episode of depression. Okay, and because I'm talking about mania and depression, let's have an insight on what mania is. Okay, manic, when you're manic, you have an elevated mood. You're happy. You have a sense of grandiosity, feeling better than others. You just feel like you're the best out there. You have pressured speech. You speak too fast, or you're always rambling about with words and speaking about a lot of things. Hence, you'll be classified as being a manic. You have racing thoughts. A lot of ideas come to you, from this idea to this idea. Others are either you're cooking this, or from cooking you want to do this, and these episodes are lasting for a whole week. In the whole week, you have ideas, you feel better than others, you're just elevated, you're happy, you're so high. Okay, on manic, when you're manic also, you have an excessive risky pleasure activities. You tend to do a lot of things that are risky, which apparently is not advisable. An example is spending. You go shopping and you shop for a lot of things that even you yourself know that this is not the right thing I'm doing, but you're just out there spending a lot of money or shopping for unnecessary things. You're also having a lot of sex. Obviously, when you're manic, it's not, obviously the sex is not, sometimes it's not with one person. You want a lot of sex, and you make decisions really fast and not the right decisions. Also, when you're into gambling, you enter into gambling and you have ideas and all that. These are some of the signs of having a manic episode. And you have to remember that this episode has to last for a week, not your 1 2 days uh episode, then you say I'm manic. That's not right. Okay, on the depressive spectrum, as depression has been a topic that is being discussed every day, but the depressive spectrum in bipolar, and it has to last for also a long time. You have low moods, you're sad, you don't want to do anything, you have a sleep disorder or sleep disturbance and a diet disturbance, you don't want to eat, you can't sleep, you have low energy levels, you can't even get out of bed, you do not want to get out of bed, your whole day is a mess and you feel like you're just low. Inappropriate guilt, you feel like you are always blaming yourself for things that are not even there. These are some of the signs of the depressive spectrum in the bipolar disorder. And so as I'm reminding you every now and then that this has to last for at least a week so that it can be diagnosed as you being bipolar. Okay, depression is also on itself a disorder. It's not just a disorder and a bipolar. We can have depression as a disorder on its own. And some of the signs that are out there that show that depression is classified under bipolar are, okay, so these are some of them. One, the depression has occurred before your age 20. Most of the time, we do not expect young people, as in you being depressed at 16 or 15 or 10 or some of those ages. It's quite unusual. Hence, when one is depressed and it's an extreme level of depression and it happens for a long period of time and they're under the age of 20, sometimes this has been pushed. The 19-year-olds and the 18, at least they've seen the daily lives, and some of the things that are happening in their lives can cause a depression on its own. Hence, the age gap is not that much, but as per now, let's say when you're 20 years and below and you get depressive episodes, it can be classified as bipolar. Another reason why your depression will be classified as bipolar and not just depression is when you don't get better with depressants. When, yes, you have been depressed and you've seen either psychiatrist or you've gone for help and you've been given antidepressants, but actually instead of these antidepressants helping you and making you feel better, you actually get worse. This will just be straight ahead be classified as bipolar. When you have a history of a family member being classified as bipolar and you have depressive episodes, hence the professionals or the doctor will check you out and classify you into the bipolar spectrum or you having bipolar. Another reason why your depression will be classified as bipolar, when you take mood stabilizers and you just get better within a month, that's just too short a time for you to get better. Hence, this depression will be classified as bipolar. And when you've already seen a doctor or you've seen somebody for help and you're bipolar, you have 3 or more episodes of depression. This depression will be it's not just depression, it will be classified as bipolar. Hence we have to we have to check the difference so that we do not say we are bipolar and we're just depressed, and also we don't overlook bipolar by just saying somebody is depressed and actually they are bipolar and they have to seek other ways of medication. Also, we have a disorder known as a borderline disorder. People also confuse borderline disorder or borderline mood swings with bipolar disorder. Okay, what can differentiate borderline mood swings from the bipolar disorder is the borderline mood swings or the borderline disorder lasts for like a day. You can be depressed today, tomorrow you're manic, the other day you're depressed, the other day you're manic. Hence, this is not the same as bipolar. There's a difference. Okay, and now that we all know this, and we at least we can okay, you do not have to diagnose yourself. You have to seek medical attention when you see any of these signs happening to you in your body, so that we can have a healthy mental health set. One of the ways that when you seek mental help, one of the ways that can be helped to that is used to help people get well from bipolar is the cognitive behavioral therapy. Most of us psychiatrists use the cognitive behavioral therapy on our bipolar patients, and also medication. With these two, I can assure you, you'll be well and you'll feel much more better, and you'll be able to take your day-to-day lives. You'll be able to go on your day-to-day lives well and appropriately without any without any hiccups or any ups and downs. Okay, thank you. Also, I would like us not to have some stereotypes. I see that the younger generation, or as people call them, the Gen Zs, you tend to use the word "I am bipolar" in the wrong way. This is actually a serious mental health state, and when one is bipolar, they actually need to seek help. So when you feel like you have variation in moods and you feel like they're severe, don't keep quiet. Come out here, seek help. There's help. There are a lot of people out here who can help you, and you'll be well. It's something that can be sorted out. And that's all for today.